The National Primary Healthcare Development Agency, under the leadership of Dr. Faisal Shuaib, has taken time out to review the Community Influencers, Promoters and Services Program (CHIPS) with stakeholders and international development partners on Monday in Abuja. Dr. Faisal Shuaib, in his address, highlighted the positive impact CHIPS has made on maternal and child health care delivery since its inception in the last 1 year.
It gives me great pleasure today that we're having, a little after 1 year, an opportunity to review the CHIPS program. But beyond reviewing the CHIPS program, it is a unique opportunity for us to recognize the work of people that have come before us, people who have been in the trenches when it comes to women issues, women rights, people who have done so much to improve the lot of women in our country. No society makes progress without recognizing the efforts of its citizens. That is why it was very important for us today at the Federal Ministry of Health and the National Primary Healthcare Development Agency to recognize the outstanding work that the Honorable Minister of Health has been doing when it comes to strengthening primary health care. He would have been here today if it weren't for the fact that he had to be at the villa for a very equally important engagement. And I know that he'll be at the villa today talking about everything that he's done in the last 3 years to strengthen primary health care and improve basic health care in our communities within Nigeria, who have been incredible in terms of the work they've done to uplift women.
He didn't shy away from categorically stating that women empowerment is key to the CHIPS program.
No civilization has ever made progress without ensuring progress of the women folk. Anywhere women are uplifted, you see those societies make rapid progress. This is a lesson for those communities that continue to suppress the rights of women.
The Executive Secretary of the National Primary Healthcare Development Agency highlighted the success recorded in Nasarawa State, the pioneer state selected to roll out the CHIPS program since its launch on the 6th of February 2018 by President Muhammadu Buhari.
Later today, you will hear a whole lot about how we've rolled out CHIPS in Nasarawa State. And in under a year, we're already seeing more than 50% increase in the number of women who are attending antenatal care. That is massive. That gives us a lot of confidence that we're on the right path. Last year was a giant step towards strengthening primary health care through community health programs. But we know as we roll out the CHIPS program all across Nigeria, hopefully rolling out in all the states by December 2019, that will be making a giant leap.
The project manager, Dr. Nana Abubakar, who anchored the review session of CHIPS program, rolled out the progress reports, achievements made so far to stakeholders present at the occasion.
Despite tremendous progress in medical and technological advancement, worldwide there are still issues with lack of access to health care, with about 9 million of those deaths being preventable. That is worldwide. The picture is not better. In fact, it's a little grimmer in Nigeria, despite the progress that has been made. Our health systems is beset with several challenges with resultant poor indices. We have every day in Nigeria 2,300 children dying, over 70% of them from preventable causes. We have 145 women of childbearing age dying. This can be prevented by CHIPS agents. These poor health outcomes came as a result of our weak health systems, which have resulted in poor coverage with health interventions. So we arrived at these poor indices due to poor coordination of the interventions being provided at the community level. We have low demand for services, poor access, poor utilization, with resultant poor indices. Going forward, globally, it's been acknowledged that universal health coverage cannot be achieved without strengthening the community component of primary health care, which is why MPHCDA is implementing the CHIPS program to strengthen that component, which before now has been largely neglected, so we achieve the universal health coverage. These community level interventions have had a multiple of challenges, which are listed there. We have a lot of different actors, different incentives, making for lack of maximum use of available resources. In an attempt to improve on this, the Federal Ministry of Health, working with MPHCDA and its partner, is implementing the CHIPS program by harmonizing and integrating the structures at the community level. The CHIPS program is looking to address those delays that result in maternal and child death. The rural communities, they are hard to reach communities. There is a woman that cannot afford transportation to the health facility. There's a woman that's giving birth all alone in her home. There's that delay, there's delay in decision to reach care, there's delay in reaching care. So by deploying a minimum of 10 CHIPS agents in every ward, we're looking to take healthcare closer to communities where they are most needed. In Nasarawa State, we have selected 580 CHIPS agents across 58 wards in all the LGAs, while we train them and the CEFPs and the officers in the health facility who will supervise them. The results so far has been encouraging. We've seen positive trend in what has been happening. Here, we can see that a total of almost 3,000 children under 5 have been visited by CHIPS agents in those wards. And pregnant women visited were almost 4,000 in number. Looking at health facility data from the DHIS2, which was analyzed, we can see from this chart that the CHIPS agents commenced work late in December. And since then, we've had an increase of over 45% in ANC attendance.
All the government functionaries, like the representative of the Minister of Health, Dr. Mrs. Ngige, also gave her remarks.
Every country has a responsibility to ensure that its citizens have access to the health care they need, when and where needed. Health is a right for the very poor and vulnerable population groups living in the most remote parts of Nigeria. However, interventions to improve the health of individuals and communities are not available in areas where they are most needed. Despite government's efforts, financial and geographic access to health services remain significant challenges to achieving improved maternal and child health outcomes. The community health influencers, promoters, and services CHIPS program is a significant effort aimed at advancing our efforts towards the achievement of universal health coverage through specific primary healthcare systems reforms. As you all know, universal health coverage cannot be achieved without significant investments in the community level component of primary healthcare, which is the focus of the CHIPS program. The CHIPS program is designed to improve on the village healthcare concept promoted over the years by the federal government. It aims to integrate all the multiple, inefficient, and poorly coordinated community health volunteer efforts from existing community-based programs into a single, well-coordinated program, taking advantage of the multiple resources that have been previously deployed. Of particular importance is the plan to use the CHIPS program as a clear transition pathway for human and material resources previously deployed for polio control in Nigeria. This includes the voluntary community mobilizers, the supervisors, the technology available for tracking, and the traditional and religious networks.
The international development partners had tones of goodwill messages to show solidarity in support of the program.
This is a red letter day for Nigeria that, the CHIPS initiative just finished 1 year. And with this 1 year, we know the ups and downs, and finally the CHIPS has been deployed in Nasarawa state, and it is a grand success and we should celebrate it. While CHIPS initiative first tabled, we know there are many skeptics around that whether it will be implemented or not. And there are huge enthusiasts about CHIPS, and we know that the CHIPS is going to be a reality. And today the CHIPS is a reality, and I'm sure that the CHIPS agent is going to be the game changer for Nigeria, changing its narrative about maternal health and neonatal deaths or many other public health initiatives. Why only one clap? It should be like.
Special recognition was made to honor great agents of the CHIPS program who are making impact at the community level as planned.
Award of CHIPS champion.
When the CHIPS program is spread across the 36 states of the Federation, there will be access and equitable coverage to essential health services at community level, which will strengthen maternal and child health care in the long run, in line with the universal health coverage. Toyin Ajolore, on duty at Abuja, Nigeria.